when you talk about musculoskeletal aging, it's now it almost is having its moment. Not quite yet, right? You and I are sisters in this, and it's not quite there yet. But from the time you are seeing a patient, there seems to be in different grades of aging. The young individual that you're seeing that pops their Achilles tendon versus the, I don't know, guy who is on a motorcycle, super healthy 30-year-old, breaks his leg. To the postmenopausal woman. Their musculature, their bone health, all is very different.
Completely.
Can you talk about some of the work? And by the way, again, there was this amazing paper, Muscular Syndrome of Menopause. You were the first, you coined that the first. Talk to me a little bit about what happens as we age from these different perspectives, both in muscle and bone. And then in menopause, because we're really behind the 8 ball when it comes to probably arguably all hormonal changes, but in particular for women.
Right. Well, since you've given me the luxury of this, I want to start back with the first work that we did at the University of Pittsburgh in the musculoskeletal aging in itself. So there was this big NIH-funded cohort study called Health ABC.
Yes,
Of course. I mean, you're a geriatrician, right? So you know this.
Yes.
So one of the researcher, Ann Newman, was at Pitt. So they followed a cohort of 70-year-olds for a decade or so and just saw what happened. And one of the things they saw happening is the quads and the leg muscles in these people, for lack of a better term, became grossly infiltrated with fat. They became well marbled. Their strength decreased. They became more frail. Having a father who has always been an endurance athlete, I became involved with the Senior Olympics, which you have to be 50 years old to compete in these things. You have to win your state games to go to the national games. They are some of the most fit people I've ever seen.
I can't believe 50 would be considered senior.
Oh, and let me tell you, the 80-year-olds are mad that the youngins are in the same race, same group as them, right?
It's true. 50's not that old.
It isn't very old.
Right.
I mean, I'll tell you, I'm way past 50. But, the NIH describes masters athletes as 35. I mean, come on, people. But, if you look at life expectancy, it's younger than midlife is younger than you think, 35 to 40. I mean, people don't realize. So anyway, Ann Newman was doing that foundational work at Pitt where I was. And I said, I don't believe it. I do not believe that is our destiny. And so most aging studies are done on populations. What do we know about our population? 70% of our population does not do one extra step of mobility a day. So what we know about aging is what we know about sedentary aging. We do not know what we're capable of long into the foreseeable future. So my group and I, we called ourselves PRIMA, the Performance and Research Initiative for Masters Athletes, began studying all these masters athletes we did a series of studies. And basically, in summary, what we found is you can preserve your lean muscle mass. You can preserve your bone density. If you do impact exercise, it's even better. We can preserve we can make satellite cells replicate again.
Which is fascinating.
Yes.
Because, and we can circle back to the satellite cell conversation, because most people would say that the health of satellite cells is in youth, and then there's senescence that happens. But yes,
you can reverse it.
Fascinating.
And then the last study we did, well, there's two remaining in that series, the brain study took us 5 years. And this was long ago. No one was talking about the relationship between muscle and brain as we are now, thankfully. But we showed that we can preserve 3 of the executive functions of the brain with chronic exercise. And then finally, right before I left Pitt, we started looking for the why, and we started studying a protein called Klotho, the longevity protein. And this is all in coordination with the lab of Dr. Johnny Huard, who's one of the leaders in muscle aging, and Dr. Fabrizia Ambrosio, who is a physical therapist, PhD, who is just brilliant. And so I say that because as a clinician, no clinician ever goes as far as they do unless they're paired with a great PhD. I wanted to acknowledge that.
I agree with that wholeheartedly.
Yeah.
I wholeheartedly agree.
So we did that series dispelling the myth that aging has to be a decline. And then most recently, I applied the passion I have for that I learned taking care of women as a cancer nurse. I began doing work with women's health in 2012, before the crest of the wave, because I think women are in the most powerful position to change the health of this country, because we make 80% of all the healthcare decisions in this country for ourselves and everyone we touch. Because I don't know about your husband, but my husband will go to the doctor if I make the appointment, or he can't play golf or various other activities he likes. So
no,
anyway.
My husband is at the doctor every week. He's like, oh, this is great. Free VA care.
Oh.
I think I should get a sleep study, cardio echo. Where's
How about
the
some
list?
acupuncture? My VA gives all the guys acupuncture. It's all good.
But majority of the time, most people are very just
that's right.
poor to follow up and don't take care of themselves at all, which is why I always harp on getting blood work, doing the basic stuff.
Yeah. Your body's talking to you, whether you're listening or not is the issue.
So you were saying that aging, based on this earlier work, that there doesn't have to be this decline of aging.
There does not.
Do we know that to be true in a meaningful way? So if we were to think about the majority of individuals are fully sedentary. 50% of Americans don't work out.
That's right.
Over 70% don't even meet the recommendations of resistance training plus cardiovasculars. So that means most people are completely sedentary.
Right.
What we think of quote, healthy normal is a disease population. Inactivity is a disease population, period.
What is normal, actually, if you frame it, is being diseased and sedentary.
Correct.
The anomalies are people that we care for or try to care for, right? But I want to, your whole mission is to pivot that. My whole mission is to pivot that.